Please meet Inna Ivanenko, Executive Director of the largest patient organization, Patients of Ukraine, which unites about 50 patients organizations in Ukraine. Welcome, Inna.
Hello, colleagues. I am very happy to be here, and I'm very grateful for this invitation. So I am Inna Ivanenko, and I'm an executive director of a patient-based organization. It's an NGO called Patients of Ukraine, and I will present today my point of view, the point of view of civil society on what is going on in healthcare sector in Ukraine now during full-scale invasion. But first of all, in order you to have a bigger picture, I would start with who we are. Our organization was created 13 years ago, and we created in order to represent rights of patients with severe and chronic diseases, their rights actually for treatment. We were advocacy organization in order to advocate for access to treatment for people with very, very severe diseases. At the very beginning, our team consisted of several people, then of 10, 15 people, and who we are now, I would say that we are a driving force for developing patient-centered healthcare system in Ukraine, because now we do work not only with patient organizations, not only unite them, but we also approach doctors communities. We work with the communities of rehabilitation specialists. We work with decision makers as well in order to influence them and to create together patient-centered healthcare system in our country. Next slide. Right now, we unite not 50, but 49 representatives of patient organizations. These are the leaders of patient organizations who represent 4.5 million of patients with severe and chronic diseases in Ukraine. At the moment, our organization, our team, has 60 plus members, professionals, and also we involve experts to our work in order to simultaneously implement a complex of comprehensive initiatives in a very short period of time. We work in clear correlation with national guidelines, with national policies of Ukraine in the sphere of healthcare sector, and also, of course, in accordance with the international practices such as WHO, World Bank, etc. Here on the picture, you can see the leaders of patient organizations whom we unite and whose interests we represent. This picture was made during the General Assembly last year. Next slide, please. I should say that Ukraine is really famous for its civil society actors in different spheres. And it happens so because you know that Ukrainians love their freedom. We know what is dignity, and we are ready to resist in case when our rights are violated. And civil society organizations, they are like a mirror of the whole Ukrainian society. That's why we have numerous organizations in different spheres, in anti-corruption sphere, in environmental protection, in healthcare sphere. They are all our partners, and we move forward, we move together in order to achieve our goals. Next slide, please. We will talk, and yeah, why we are back, yeah, thank you. So why we as civil society actors are so strong in Ukraine? I think because, first of all, we are intolerant to corruption. We are driving force for changes in our spheres, in different spheres, and now we are perceived like partners by state authorities, and we have a possibility to influence state policies in different spheres. Next slide. If to talk about civil society in Ukrainian healthcare sector, there are different functions which civil society and roles which civil society played and plays now. I will stop on them. So next slide, please. Watchdog function. It started back to 2007 when we as patient community, I was working at those times in another but also patient-driven organization. But back to these times, we ensured analysis of corrupted tenders, which were made by the Ministry of Health. They were procuring medicines and medical devices and everything in a most untransparent way. We monitored all these processes and attracted media attention to the results and showed this corruption in the Ministry of Health. So it was very, very strong watchdog function, and we started with this role. After the Revolution of Dignity, 2015, we understood that there is a window of opportunities. We can be not only watchdogs, but we can suggest something. We can initiate the reforms in our country. We can do it. It is possible at the moment. And of course, we took this possibility and initiated first the reform of public procurement of medicines, which was made in a corrupted way by the Ministry of Health. We drafted with our lawyers a law which was then adopted by the Verkhovna Rada of Ukraine, our parliament, which eliminated corruption from tender procurements of medications at all. Now, the medicines are procured within the state budget without corruption by the, now it is happening with the help of not the Ministry of Health, but state enterprise medical procurements of Ukraine. Natalia Husak mentioned it already, and this is a reliable and very transparent governmental institution, which makes its job very well. Also, we were initiators and then supporters of the whole reform of healthcare, financial reform, which Natalia Husak described you in details. But the patient community was the first who stand and told to everybody, to decision makers, that it's enough. We don't want to live anymore in Semashko system, in the Soviet system of healthcare. We need something new. We move forward. We want to be European country, and it happened so that all members of Ministry of Health of those times, minister, deputy ministers, and civil society joined their forces efforts together, and we advocated the implementation of this reform, and now we work actually in the new system, work and live and use services of this system. If to talk about now, starting from 2022, one slide back, please. I will finish it. Yeah, thank you. We are see ourselves as a reliable partner of state governmental bodies. As after full-scale invasion, we understood that we also can use our resources in order to help healthcare system to survive during the war. We developed, we are working on development at the moment of the state system of rehabilitation services. We recover primary healthcare institution which are damaged on the deoccupied territories by the Russians. And we also provide emergent humanitarian support to the hospitals by medicines, by medical devices, because every day we have a lot of injuries due to missile attacks. Civilians, our defenders, a lot of, and of course, hospitals need more and more medicines to deal with it. Next slide, please. How the system, healthcare system works now, I should say, from the patient's point of view, and I believe that all patients will share my point that it is much better than before the reform. Natalia Husak described in details what they are doing, and we do really appreciate this transparency, this accountability, and that the patient is free to choose the doctor, and the healthcare services can be provided free of charge to the patients. In some cases, I should say that our system is better than in European countries because we do not have long lists to make an appointment for the specialist to receive a diagnostics, or even if we are talking about those healthcare services which are not covered by the state. They, for example, dentist care, it is still affordable for Ukrainians. It is not too expensive. But of course, we have a lot of issues which we try to deal with. For example, still we have this post-Soviet heritage. It's domestic corruption in the hospitals. It takes place because very often when the patient comes to the hospital to get services free of charge, which were paid already by National Health Service of Ukraine, doctors ask them to pay informally for these services. So it's out-of-pocket payments. We are doing a lot in order to overcome these out-of-pocket payments, but still, unfortunately, they are in place at hospitals. It's a small corruption, and we fight with it. Also, it's an insufficient budget funding for the whole healthcare sector, and as I represent the interest of patients with severe diseases, I see how budget is insufficient to procure medications for this category of patients. These medications are provided by the state, and unfortunately, patients with oncology, patients with rare diseases, tuberculosis, HIV, AIDS, etc., they do not have enough medications which are available in European countries in order to be healthy. especially when we are talking about the second line of treatment, which is not first line and which is more expensive. Next slide, please. Here I can present you a case of the role of civil society on the example of Ohmad-Dit. Ohmad-Dit, it's our biggest children's hospital. If to translate into English, it's a protection of maternity and childhood. You know that at the beginning of July that there was a missile attack on this hospital. Next slide, please. And 35 million euro was gathered very quickly for the reconstruction of this hospital. Again, next slide, please. And some commission organized a tender procedure to choose the winner who will make this reconstruction of the Ohmad-Dit. But unfortunately, the most expensive participant was pre-selected as a winner. At the same moment, next slide, please, anti-corruption journalists who are also our partners reacted and revealed this fact that the one of the most expensive winners is going to be selected to make a reconstruction of the biggest hospital. And of course, this tender was stopped. Next slide, please. The Minister of Health reacted immediately on these publications. He held a press conference where he announced that the decision is to cancel this tender and to establish a civil society supervisory board in order to control all the funds gathered for Ohmad-Dit reconstruction. And these supervisory boards should ensure the accountability and transparency of all the procedures of further reconstruction process. Next slide, please. Our organization joined this supervisory board, and I was elected as a head of this board. It's a great responsibility, huge responsibility, I should say, but we are working already with our board for 1 week, and we already have very good results because the examination of all the damages is already launched, is started. It is done by the best state institution in Ukraine, and based on the documents of the examination, we will launch very transparent tender in order to choose the best winner who could repair this building. Next slide, please. What is our contribution as civil society actors, and what external help we would appreciate for the whole system? As I told already, our weak place point is corruption, and we are dealing with it by ourselves. We are working with National Health Service of Ukraine, with the Ministry of Health of Ukraine, in order to implement instruments which will influence hospitals at places and eliminate corruption. We are partner. We are already doing very concrete activities, and we will deal, I'm sure we will deal ourselves, but it will take not 1 year, I suppose. we need help in external help in rehabilitation of healthcare institutions because the damages are huge. We as only as one organization have already rehabilitated 46 primary healthcare facilities which were damaged during the war, but the demand is huge and all international help is very appreciated, including the fact that our healthcare facilities should meet barrier-free environments. So we build back better. When we rehabilitate these healthcare facilities, we include barrier-free requirements and make them really barrier-free because we already have a lot of people with disabilities. Also, external help to develop a rehabilitation system in Ukraine will be appreciated. We are working at the moment a lot on this topic, and we work on formal education of rehabilitation specialists. So we just work with institutes, with higher educational institutions in order to relaunch this educational system from the scratch, because we also have post-Soviet heritage in this sphere also, and rehabilitation services should be very modern and provided according to international standards. As I told at the beginning, very important thing is access to treatment for patients with severe diseases, and it's not enough for us, and our budget does not allow to cover needs of patients with severe diseases who still live in Ukraine. Some patients, of course, during full-scale invasions left our country, and they are supported by European countries, and we very appreciate it. But a lot of patients are still at home, and at home they do not have access to the second, third line of therapies when they need to be saved. So we can't save these people with those medicines which we have. And here I also understand that the substantial input of European countries to our state budget, because all the healthcare system is covered by our partners, by European countries, and we need more substantial input to it in order to cover all the needs of patients with severe diseases. And here is contacts of my organization. I know that the presentation will be distributed, and here you can find how to find me and my colleagues. Thank you so much for this possibility.